And today I'm giving you 17 everyday culprits that will raise your high blood pressure. Now, you know that high blood pressure is a leading cause of heart disease, strokes, and kidney disease. And most people with high blood pressure have what we call primary hypertension or essential hypertension, meaning it's just the luck of the draw, mostly your genetics, and there's no one identifiable reason that you have high blood pressure. You just do. Now, how do you know if you have high blood pressure? Well, if your systolic number, that top number, is 130 or greater, or if your diastolic blood pressure, the bottom number, is 80 or greater, then you have high blood pressure, you have hypertension. Consult with your doctor. And yes, even though sometimes it's just the luck of the draw and you have the diagnosis, that does not mean you are powerless, because there are many factors that can trigger your blood pressure and make it higher. So that's what we're going to talk about today. If you knew that there were things that you could dodge, that you could avoid, that would help to keep you from raising your blood pressure, like, wouldn't you want to know it? Then let's talk about it. I'm giving you 17 everyday culprits that will raise your high blood pressure numbers. Number one, stress. You already know when you're stressed out, that causes your stress hormones to rise, like cortisol. This makes your blood vessels tighten. It sends your blood pressure up. So everyday things like being at work, having pressures in relationships, parenting, anything that causes you stress can cause your numbers to go up. So find ways to manage your stress. Number two, cell phones. Okay, we all need cell phones in our daily lives to communicate with our family, loved ones, work, kids, but cell phones can be stressful, especially when that notification button is going off or when you're trying to see if it's a spam caller versus a person you really don't want to talk to. Cell phones can stress you out. So find ways to manage your time so that you're not on cell phones all the time and you don't become just like totally dependent on them. They can stress you out and they can make your blood pressure go up. Number three, daily traffic, especially depending upon where you live. You have rude drivers who want to fishtail you and cut you off. You have people with road rage. You have traffic. You have construction. Why do people sit up here and do construction in the middle of rush hour? I'll never know. And if you're running late and you're in heavy traffic, that can stress you out. So try to avoid that, or else your blood pressure numbers can hit the roof. Number four, coffee. Yes, caffeine. In some people, caffeine can have a short but intense effect on your blood pressure. It can send your blood pressure up. Now, this doesn't mean that you absolutely have to cut coffee out of your diet, but it does mean that if you have high blood pressure, you need to consult with your physician and figure out what levels are safe for you. Be sure to watch my video on Is Caffeine Bad for You?, where I discuss the science behind it after you finish watching this video. Number five, parenting. Oh my gosh. If you are the parent of little kids, toddlers having temper tantrums, falling all out like fainting goats, that can be stressful. Also, just figuring out your work-life balance, having the parental guilt because you're not there enough, or if you're there with your kids and you feel like, oh my gosh, I need a break from these doggone kids, that can be stressful. Also, having deep conversations, especially with adolescents. Oh my gosh, if you're talking about the birds and the bees and the flowers and the trees and you're trying to have honest conversations with your kids, yet you don't want them to know all of your business of when you were a teenager, that can send your blood pressure up. So parenting, figuring out coping mechanisms can help you keep from shooting your blood pressure up. Number six, political elections. Enough said, really. But things can be so divisive when it comes to politics. And so watching politics and, realizing that you have to control what you can control and let certain things go is frustrating. Understanding that even when you're trying to encourage loved ones to vote, and sometimes they're not listening to you, that can be frustrating. Also thinking about the future and just how much weight political elections can have on you, stressful. And even on your friendships, you may be friends with people who have very different political views, and that can send a wedge. All of these things can cause your blood pressure to shoot up. Number seven, financial concerns. Yeah, worrying about money can definitely raise your blood pressure. Thinking about bills. Can you pay your telephone bills? Thinking about loans, thinking about loan forgiveness, just thinking about planning for the future for yourself, worrying about the financial stability of your family, of loved ones, giving loans, receiving loans, just anything dealing with money, financial concerns can definitely send your blood pressure up. Number eight, work deadlines. Yes. Deadlines are everywhere and they can certainly be stressful. Trying to figure out your schedule, trying to figure out that balance. Definitely work deadlines can be a cause of your blood pressure shooting up. Number nine, disagreements or arguments. I don't care if it's a disagreement with a friend, with a child, with a partner, with a loved one. Even disagreements with total strangers on social media can cause your blood pressure to go up. So please choose your battles so that you can maintain a normal blood pressure. Number 10, sleep disorders. If you're someone who has insomnia, meaning you have difficulty falling asleep or staying asleep, this can cause you to have a high blood pressure. Or if you have a disorder like obstructive sleep apnea. How do you know if you have it? Well, you can get formal testing and you should consult with your physician. But if you're a person who snores, okay, if you are snoring loudly, and all of a sudden you stop breathing, absence of breath, apnea, then you very likely have obstructive sleep apnea, and this can cause your blood pressure to rise. It's actually quite serious. Number 11, smoking. If you smoke cigarettes, just please stop. They're on the list of every risk factor practically for every disease. But definitely, smoking is a risk factor for high blood pressure. It causes inflammation, it causes heart disease, and whether you're the active smoker or if you're sitting around inhaling secondary cigarette smoke, it can make your blood pressure go up. Number 12, excessive alcohol consumption. Yeah, you can blame it on the alcohol if your blood pressure is up. If you are drinking in excessive amounts, if you're binge drinking, or even if you're just drinking daily amounts that are too high, it can cause your blood pressure to go up. Be sure to watch my video on the dark side of alcohol after you finish watching this video. Number 13, obesity. If you are a person who is living with obesity, then this could cause you to have an elevated blood pressure. So by definition, with a BMI, body mass index, that's if your BMI is 30 or greater. Or if your calculation based on your body composition shows that you have excessive amounts of body fat, visceral fat, then you may also be a person who's living with obesity. Consult with your physician. So yes, living with obesity can increase your risk for heart disease, for hypertension. But there's also another component to it. And it's the way society acts towards people who are living with obesity. I was having this conversation with someone that in many ways, it seems like discriminating against people who are overweight or who are living with obesity almost seems like people think it's the last acceptable form of discrimination. It's not right. And what's really annoying is that a lot of people who say will troll someone who's living with obesity on the internet will come with this faux concern. Oh, I'm just concerned about your health. And it gives them an excuse to discriminate. And that stress of discrimination can cause your blood pressure to rise. And another thing, colleagues, okay, fellow physicians, you can be culprits too in causing people who are living with obesity to have blood pressures that are high. And this is why a lot of times patients with obesity are even scared to go to the doctor and give complaints because it's like no matter what you say, the doctor's going to say, well, you know, if you lose weight, it'll get better. Even if the problem really doesn't have a direct relationship with the patient's size. They can say, you know, my shoulder is itching or my nose is tingling, and the doctor will just, well, you just need to lose weight. That can be stressful, and it can make patients who are living with obesity less likely to go seek medical attention, which of course can make the problem just prolonged. So yes, living with obesity can raise your blood pressure for many reasons. Number 14, coworkers. Oh my gosh. Yes. Being at work with other people, having to manage interpersonal relationships, being in situations where there is competition that's built up between coworkers, you know, and especially if you're someone who's not really all that into people, like if you're not a people person. My oldest daughter is an introvert and she wears a t-shirt that says, "It's too peoply outside." Well, if you feel like that, okay, if people kind of get on your nerves a little bit and you think it's too peoply outside, then dealing with coworkers can certainly make your blood pressure rise. Number 15, medical appointments. If going to the doctor stresses you out, this can cause you to have white coat hypertension, meaning that your blood pressure is more elevated in the doctor's office than it actually is at home or when you're in calm environments. And this can be due to a lot of reasons. Mainly, when you're the patient and you go to the doctor, in that moment, you're not really in a lot of control because you don't know what the doctor is going to say about your health, what the doctor is going to tell you to do. And it can put you in a situation where you're stressed out and your blood pressure shoots up. It's oftentimes a good idea to log your blood pressure at home. I have a lot of my patients to do home blood pressure logs, or I have blood pressure monitoring systems for home because I do know that medical appointments can cause their blood pressure to shoot up. Number 16, unhealthy diet choices. You already know this, that if you're out here eating an unhealthy diet, that can cause your blood pressure to go up. Unhealthy diet. What do I mean? If you're eating a diet that's high in salt, high in sodium, okay? According to the American Heart Association, the average adult should be eating less than 1,500 milligrams of sodium a day. If you're eating a lot of salt, that can make your blood pressure go up. Also, processed foods. You want to avoid eating a lot of processed food. It can lead to inflammation in your blood vessels, weight gain. No bueno, okay? It's not good for your blood pressure. You want to avoid eating a lot of saturated fats, trans fats, and you want to make sure you eat a diet that is rich in fruits and vegetables and in foods that have antioxidants and phytochemicals, all of those things. But yes, eating an unhealthy diet can certainly cause your blood pressure to go up. Don't do it. Number 17, sedentary lifestyle. Having a sedentary lifestyle, being a couch potato, you already know that can make your blood pressure go up. You want to make sure you move your body, you exercise. And that doesn't mean you have to have the most expensive gym membership. It doesn't mean you have to be around here lifting all kinds of weights and trying to be the Iron Man for 3 hours a day. No, just move your body. Yes, according to the American Heart Association, the recommendation is for you to exercise 150 minutes per week. That's about 30 minutes, 5 days out of the week at least. But some studies also show that even if you move your body for 11 minutes a day, then that can also contribute to a better overall health. You know, you can take the stairs instead of taking the elevator. You can park far away from the grocery store instead of taking that close parking space, you know, in order to get some extra exercise. During your lunch break, you can walk around the parking lot or walk around in the building. You can, you know, figure out chair exercises or do chair yoga if you're someone who has problems with ambulation. If you have arthritis or joint pains, you can join a gym or find out how you can get access to a pool and do some water aerobics. There are all kinds of ways to move your body, but just please do, because a sedentary lifestyle can raise your high blood pressure. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about.